Hi, my name's Phil. I'd like to come out politics. So we have another day when Labour had imagined the news would be all about another huge plan for the country, and it's instead about tensions within the government over a monumental cock-up. Could Labour please learn the lesson? There is nothing they are doing that is so important or of such public interest that the media will not focus on sensationalism. If Labour want the media to report on their real work in government, stop feeding them drama. But Labour are today publishing its 10-year plan for boosting mental health care and moving care into the community to give people better and faster access to doctors, scans, treatment, and actually a load of other services. Labour would have wanted this to be all over the news today, not their Chancellor worried about which of her previous promises was least risky to abandon now. But first, for daily news and politics, please click the subscribe button to stay notified. So Labour's plan for the NHS is not just to repair the services which the Tories damaged. It's to effectively create almost a new NHS in parallel to the existing one. The idea is build community hubs, sometimes centres all under one roof, which will contain diagnostic equipment, post-operative care facilities, mental health services, nursing, all close to where people live. Once fully up and running, they would be open at weekends, on Saturdays at any rate, and in the evenings as well. Governments often talk about game-changing plans for various public services, but if there were a health centre in your local community that had all of these services, who could deny that this really would be a game changer? And these centres will also bring in other services as well, including debt advice, employment support, preventative help for smoking, weight management, and in terms of other medical services, even dentistry has been mentioned. If the reality matches the vision, then what we're talking about here are lots of key public services in one-stop shop, accessible for everyone, 6 days a week, 12 hours a day. Achieve this, and nobody will be able to deny that Labour has delivered. Some of the transport issues, for example, which prevent people being able to get quick access to diagnostics and care, that would be removed. It would also leave hospitals free to focus on their secondary healthcare, which is their main job, instead of being inundated with the problems of other services which have been hollowed out. It's a very big plan. It's not going to be easy. Some have pointed out that a lack of access to qualified healthcare professionals will be one major hurdle. I can certainly believe that'll be a problem. The strain on hospitals can't ease until after these community centres are set up and running, and they can't be set up and running without staff. So West Streeting needs to not only provide the staff needed for our overworked NHS hospitals, but extra ones for these new projects. Now, once it's all up and running, yes, the pressure should ease. But to get to that point, you need to develop the systems in parallel. It's like developing any system. You still have to maintain the old one as you're doing it. The difficulty here is that we're having to modernise the NHS at a time of tight public finances and after we've cut ourselves off from easy access to staff through a combination of Brexit and anti-immigration policies. That being said, I imagine workers for the NHS will be prioritised when it comes to immigration planning. This is not a project which Labour can really afford to fail. In fact, although this is a 10-year plan, they're of course going to need some of it to be very visible before the next election in order to get the next election to give them the time to finish it. In terms of political strategy, what I would be wanting to do is setting up some of these centres in some key red wall areas. You call them, pilots, I suppose. Set them up in key red wall areas really quickly. Now, that would not only provide a lot of useful learning opportunities for rolling them out across the rest of England, but let key voters feel the improvements with a Labour government. Because although I will keep saying that Labour need to up their communications game, no matter how much the media keep ignoring Labour's work, people will notice if healthcare centres suddenly appear on their doorstep. Stuff like this, people notice without needing to see it in the news. Some others have pointed to the fact that similar proposals have been made before. In fact, various objections refer to the fact that this general plan has been in the works since the 1970s. But although that can underline just how difficult a task it is, it also shows that if we've been trying to do something for 50 years, then it's clearly a good idea. If decades worth of health professionals have been saying what we need is more care in the community, then that's a really good reason to do it. It's not a reason to go, oh, well, others have tried and failed, so we won't even bother. But as part of this cautionary tale, of course, The Guardian published 3 examples of when previous governments had attempted to reform the NHS. It gave 1 example under the last Labour government and 2 under the last Tory government. And I read it and I thought, okay, so what you're saying here is Labour's plan succeeded and the Tory plans failed. What was the difference? Labour's plan gave the NHS extra resources. The Tory plans were both motivated by the desire to save money. What had happened is Tories had introduced austerity, which had meant squeezing the budgets for including the NHS. The NHS then started failing and the Conservatives said, oh, this is no good. What do we do about it? Should we actually up their budgets? No. What we need to do is deliver the same services for less money. That was the motivation, to offer healthcare on the cheap. Well, just as what happened when Labour tried to do the same with welfare, where their primary motivation was not delivering better service but saving money, perhaps we might conclude that reforms to essential public services which are motivated by cost cutting rather than better service are doomed to failure, because they're not really reforms at all, are they? Labour's NHS plan has been given an additional £52 billion. Now, okay, that may not be enough for what they want to do in the time they want to do it, I don't know. But it's definitely not a cost cutting measure. Even though if it works, it will actually save money in the long run. If people get better access to mental health care, for example, there won't be as many people needing personal independence payments, will there? And Labour's problem on the welfare front melts away. If the moves to better prevent serious illnesses rather than just treat them when they happen works, then the NHS will not be a stretch in the future either. If this 10-year plan succeeds, healthcare becomes more affordable for the state in future. But the aim of the plan is not cost cutting. It's making people healthier, letting people have easier access to healthcare, which improves outcomes and therefore productivity. It's also worth pointing out a few of the details in Labour's plans to boost access to healthcare as well. Like one thing that stood out to me, they've announced what's been called an innovator passport. So this system is designed to allow new cutting edge treatments to be rolled out across the NHS once it's been assessed by one part of it. It's an idea to prevent duplication and to let new treatments be used more widely once they've been passed for use anywhere in the NHS, instead of being used to some good effect in one NHS area. Like, there's no shortage of articles on some groundbreaking treatment that's been getting really good results in a particular hospital. And then you think, oh, so why can't we get this up here? Oh, it has to go through the procedures. It's already gone through the procedures. They're using it down there. So it's there to stop trials of something going, oh yeah, this is really good and it's working really well. And then everyone goes, oh, we should do some trials on it. It's a way of basically saying, look, these guys already assessed it. They're as competent as your guys, so just bloody use it to treat your own patients as well. There's plenty of joined up thinking in this plan as far as I can tell. The main challenges will, of course, being able to physically build the centres. If they're going to be in the heart of local communities, there needs to be a suitable site within that community to build it. And also the staffing. That's huge. Can't downplay that. And because Labour cannot assume the public will automatically give them 10 years if they aren't good enough in the first 5, they need to be able to showcase some of this plan before the next election, which is why I would rush some of these centres through in some key areas now, really quickly. But getting it right, even mostly right, I think will be huge. For a lot of people, the access to all of these services close by will be massive because a lot of people have transport problems. And even if you don't, there's sometimes car park problems in a lot of hospitals. For me, just the fact that the NHS will have the capacity to offer mental health services, that'll make a huge difference. I know the NHS technically has mental health services, but I'm going to say I've known a lot of people in my time who have had serious mental health illnesses. Some very long term. I don't know a single person who ever got help on the NHS. And I don't mean antidepressants from the GP. I mean actual treatment. I don't know a single person who got it. Not one. And the difference this could make to people's lives, as well as pressure on other public services, cannot be overstated in my opinion. I mean, just think about all the problems which would ease if we had proper mental health care in this country. In fact, this might be the single most important thing Labour are doing right now. It's politically crucial for any Labour government wanting to be re-elected to get the NHS working. It will ease both productivity problems as well as take the pressure off other public services, which means that those other public services will get better. It could literally be the difference between success and failure for Labour. But let me know what you think in the comments below. For more content, you could subscribe to the channel or even join for access to streams and behind the scenes updates. Thanks for watching, and until next time, I'll see you later.